Today we're going to go over Graston techniques for the upper trap. So today we're going to be showing you a couple of different tools that you have in case you don't have these ones, and a little variation. So we're going to use a Graston tool number 4 and a rock tape one, the different edges, and we're going to be using rock rub today. To show the first technique that we like to use here, patient is going to be sitting. We have good, we can access the area that we want to. So we take a little bit of the rock rub, just a little bit. Too much of this stuff, it gets too messy. A little bit of this goes a long way. So to apply that to the area that we're going to be working. And it's important for us to work the origin and insertion of it. So even all the way up into the cervical spine here and all the way through the area that covers. So I'll just get the patient just used to the touch of the tool that we're going to be using. And so I ask the patient, how does this feel? Is this pressure okay? Are you okay with this?
Yeah, it's good.
Okay, so once they say it's okay, I like to work that tissue a lot, trying to get that tissue to relax, a little bit more gentle in the cervical spine there, and really work that muscle tissue there. And now I can see some areas of redness here. I'm seeing some areas that are loosening up. We can also tilt the patient's head here to the side, a little side bending, to put that muscle on stretch, to press the shoulder maybe a little bit. And we can put that muscle on stretch and really get in there and work the muscle. A technique that we have found works pretty well is having the patient in prone. It allows those traps for a lot of the patients we see who have really tense upper traps and over dominant upper traps. They sit like this and it's hard for them to relax. So having them in a prone position just allows those muscles to relax a little bit more, which I'll show next. So now we're going to show you just a little variation that we like to do with the different rock tape tool. I'm going to get some rock rub. Apply this to the area we're going to be working. And now in this position, the head of the table is a little bit flexed. Put that cervical spine a little bit of flexion. Arms are nice and relaxed at their side. And we just really want the patient just to relax. And using the more pointed edge here, can just very gently work here into remember to work the origin and insertion. So working up into the cervical spine here. Ask the patient, are you okay with that pressure there? Yep. And then we can use the different edges of this tool to really get in there and work that upper trap in here. It works well with the curvature here and can be more aggressive with it. If the patient's not responding well to it, then we can ease up on the pressure and really getting in there, trying to work all aspects of that upper trap. And again, we start to see some areas of redness here, just points that are breaking up in that muscle. So our patient's nice and relaxed here, always making sure that we ask them, how does it feel, how are you responding? We found a lot of success with the prone technique for this type of tool. Thanks for watching our video today. If you like the content, go ahead and give us a thumbs up. Click that subscribe button for all of our other videos. Stay tuned, as one of our next videos we're going to show how we stretch the upper trap and the levator scapular muscle.